gallbladder disease, heartburns, and the list goes on, chronic leg ulcers and all those things. So when we get patients to lose weight, all these problems disappear. This is the beautiful thing about weight loss surgery. With one operation, you can cure about 10 different things. Unfortunately, most people don't come to us because of these medical reasons. They come to us because of the psychosocial impact of obesity. The patients come to us because society doesn't accept the fat person. The patients come to us because they cannot walk into the store and put on a dress, buy off the rack. They have to go to special stores. They come to us because they cannot sit down and cross their legs like the average person. They cannot get into a plane and fit in a seat. They don't go to a movie theater because the seats are too small. These are the reasons that the patients come to us. We call them daily acts of living. They are limited. They don't want to go out because they're shy. They become withdrawn, and food becomes their companion. So they just get overweight and get bigger and bigger and eat more and get bigger and bigger. So they come to us because of the psychosocial impact of the weight, the physical impact. However, by us treating them, we are also able to take care of those comorbidities. If you know that 9 out of 10 people who have type 2 diabetes have that because of obesity, if we could eradicate the obesity, then we would be eradicating 90% of those with type 2 diabetes. Most weight loss patients, especially those who are 250 pounds and above, will need some reconstructive surgery. When they lose weight, they have saggy skins around their tummy, around their arms, but they don't have to have it. It's just that they feel very gratified with the weight, but they don't feel good when they take off their clothes and look at their bodies. So they need reconstructive surgery to take away the excess skin. We do some of the reconstructive surgery ourselves, like what we call it armplasty, where we take away the flaps from the arms. We do tummy tucks. We do breast reduction because the breast becomes saggy. We do thigh lifts. They do body lifts, total body lifts. And right now, because the large number of cases that are being done, we now have a specialty which is called plastobesity. That means plastic surgeons who specialize in doing reoperation and reconstructive surgery in obese patients who have lost weight. When we first started doing this work in the 70s and 80s, plastic surgeons wouldn't touch these patients. So most of the reconstructive surgery was done by us bariatric surgeons. But with about 200,000 patients having bariatric surgery now, there's a big market there, and there are many plastic surgeons who are now specializing in reconstructive surgery in patients who've had bariatric surgery. During the first visit, you would be told you are a candidate, but it takes about 3 to 4 weeks before you will be approved, because to be a candidate means that you weigh a certain amount, which is usually described in terms of BMI. BMI is a term we use to categorize the amount of weight a person has. It is the weight in kilograms divided by the height in meters square, which is, you can find that information in your computer. Just look for a BMI. People who have a BMI of 35 and above are candidates for weight loss surgery. That stops there. But to be eligible for the surgery, there are other things you have to go through. You have to go through the psychotherapy, the nutritional evaluation, the cardiology evaluation, the pulmonary evaluation. There are some people who come for weight loss surgery with different motives. Those are not good candidates. You cannot come to have weight loss surgery because that will help you find a husband, because there are many skinny women who don't have a husband. If you did weight surgery on such a person, you're going to have a poor result, because when they have the weight loss and they don't have a husband, they're going to be miserable. First, they can't eat. Now they don't have the husband they're looking for, so it's a disaster. So you have to make sure that the patient's motivation to have surgery is appropriate. And then they're getting the approval from the insurance companies after they've been evaluated and felt to be safe for the surgery. is the next step. And once that is done, then the patient is scheduled for surgical treatment. It's a personal decision. We just give them the information. We try to ask them to come to support group meeting and see other patients. Some of them are embarrassed, some of them are afraid. And it's very normal, because to us surgeons, surgery is a day-to-day thing, but to the common person, to be put to sleep is something scary. So it takes a lot of motivation on the part of patients to decide to have surgery. So we see that quite commonly. And then they rationalize. Some said, if God meant for me to be fat, that's why I'm fat, I'm going to stay that way. Well, that is their choice. But we know that weight does limit the lifespan of people and limits the productive life. You don't see too many morbidly obese people who are above 50 years of age. Severe obesity cuts the lifespan down by 20 years. So once they get to realize this, you're going to find many of them want to do something about their weight. On the first visit is a free visit. It's called an informational session. You'll be shown a videotape that talks about obesity, the various non-surgical treatment, the surgical options that are available, and you'll be given the option to think about it, whether surgery is an option for you. If you decide that surgery is an option, then you'll be scheduled for a consultation with one of the surgeons. If you think surgery is not an option, you walk away and you don't have to come back. Nobody tries to talk you into having surgery. There are quite a few patients who come in for the session 2 or 3 times before they make up their mind, which we think is a good sign, because we don't want anybody making up their mind in a hurry. On the other hand, 90% of the patients who come in already know what they want, because that information is readily available on the network. Patients go and research what surgery they want. They research the surgeon, they research the center. So when patients walk in, for instance, coming to my clinic, they already know, I'm coming in to have the Fobi pouch and I want Dr. Fobi to do it. Or I'm coming in to have the lab band and I want Dr. Naim to do it. Or I'm coming in to have this sleeve gastrectomy and I want this doctor to do it. Most of these patients coming in are well informed because they've done their research on the network. The availability of information on the network has done a lot to alter the way medicine is it's practiced. Oh yes, a good number of people call in to get information. We have a patient counselor that is in office full-time. They will talk to you on the phone and give you as much information as you need. And in addition, they will mail out pamphlets that have all the information. You don't have to come into the office for the free informational session. You can get all that information. And then they also refer you to the website we have. And through this website, you can get further information. And at that time, if you decide to come in, then it's up to you. We'll be glad to take care of you. Oh yes, we still get patients who get to know about the surgery and who can afford it want to go to the best. And those who know that I have been in the field for a long time and they know my results. I have patients coming in all the way from Israel, from Russia. I had a patient that came in all the way from India. They can afford it. It's like any type of healthcare. When you can afford it, you want to go to the best. If you have cancer, you want to go to a Cleveland clinic or a Mayo clinic. If you want to have a bariatric operation, you can afford it, you want to go to where Dr. Fobi is or another expert in that field. So people do travel. Unfortunately, with the situation with the healthcare insurance companies, they now have special contracts and special hospitals where you can go to. So most people cannot really afford to go to where they really want to go. They go to where the insurance companies will pay the most. And that is due to the financial restrictions. But patients who don't have the financial restrictions come in. That is why most patients who pay cash come from, like I did a couple of patients. One came all the way from Alaska, the other one from Washington. And I have a patient I'm doing next week that came all the way from Nevada. But these are patients who are coming to pay cash. They want the surgery, they know who they want, and they're willing to pay for it. For the Fobi pouch, the hospital stay is 2 days. For the lap band, sometimes we do it as a day surgery. You go home the same day. Most times we just keep you overnight. With the lap band, you can resume work within a week, 7 days to 10 days. With the Fobi pouch, 14 days to 21 days. And with the gastric bypass, 14 days to 21 days. Really, how soon you resume work depends on how the operation was done, whether it was done laparoscopic or open. The laparoscopic approach is what has made surgery so safe. The Fobi pouch is done laparoscopically, the gastric bypass is done laparoscopically, and the lap band is done laparoscopically. So the pain is minimal. The patients are out walking the same day of the surgery. Most of them go home within 24 to 48 hours, and they can resume normal activity within 2 weeks. In terms of sexual activity, after the lap band or the banding procedure, you can resume sexual activities within 14 days. With the gastric bypass or the Fobi pouch, we normally recommend 30 days. And then with the biliary diversion, it's normally 6 weeks. What is interesting about weight loss surgery is that people who are overweight develop a certain amount of infertility. Losing weight increases the fertility because it takes away the fat around the ovaries and the tubes where the eggs are formed. And so as you lose weight, your fertility goes up. So we recommend to patients who have weight loss surgery to practice what I'll call take medications to prevent pregnancy for at least 12 to 18 months so they don't get pregnant. Because the fertility goes up, particularly during the first 6 months when you lose rapid weight. That happens the same with all the operations.